Tonight on The New Reality,
Black Lives Matter! I can't breathe!
protesting during a pandemic.
People coming together to address a major issue that we have in Canada, which is anti-Black racism.
Racism on the rise.
People started questioning, was it safe to approach me anymore just because of my Asian background?
The coming cash crunch.
A health crisis triggers an economic crisis that likely is going to trigger an insolvency crisis.
The cost of disposable protective gear.
It's another plague. Unfortunately, it's another plastic plague.
And how to plan a summer vacation.
If you're planning to go further afield, call where you're wanting to go and make sure that they are open.
Hello, I'm Dawna Friesen. After months of being told to stay inside, to keep our distance from other people, now we're watching hundreds of thousands of people gather on the streets to protest police brutality and racial injustice, making an already deadly situation more complex. These protests, the outrage, the calls for justice would be extraordinary at any point in American history. That they're happening in the middle of a pandemic in a country that has the most cases and the most deaths from COVID-19 makes this moment exceptional. It's never happened before. The spread of an invisible virus and the very visible death of an unarmed black man pinned to the ground for almost 9 minutes by a white police officer has led to an intersection of two of the biggest challenges our society has faced. Healthcare workers who were cheered on for their courage, now cheering on protesters who demand that Black Lives Matter. A public health crisis that's killing people, converging with racial inequality that's killing people too. Black Americans make up roughly 13% of the population, yet available data shows they account for close to 25% of overall COVID-19 deaths in the U.S., and in some counties, close to 60%. How does that compare with Canada? No one knows. Governments here don't collect COVID-19 data based on race and socioeconomic background. That is starting to change because what doesn't get measured doesn't get addressed. There's a gap in data collection that advocates say could paint a more fulsome picture of disparities in Canada and allow for evidence-based decisions on how to shape future policy that remedies injustices. With me to explore this further is Dr. Akin Norum. She's a family doctor and a public health and preventative medicine specialist. She's the Associate Program Director of the Public Health and Preventative Medicine Residency Program at the University of Toronto. Dr. Norum, thanks for speaking with us today. Let me ask you first, as a public health specialist, when you see all of these people out on the streets in close contact in the middle of a pandemic, knowing the novel coronavirus has not gone away, how much does it concern you?
I think the fact that people are willing to go out and speak about human rights issues, even though that they know that there is a COVID-19 pandemic, but they feel that passionately about it, I think deeply moves me, in fact. I think overall, as a public health physician, I can say that it is important, as Dr. Theresa Tam and others have said, to wear personal protective equipment, so wearing a mask, using sanitizer. But what I see as a Black woman and physician is people coming together to address a major issue that we have in Canada, which is anti-Black racism, which has in fact been contributing to worse health outcomes for Black people for centuries. Anti-Black racism traces back to our history of slavery, of having segregation here, but also just a series of issues around community injustice.
Canada is not the United States. We do have a different history here. We like to pride ourselves on tolerance and diversity. As a Black woman and a Black physician, explain to us your experience, your lived experience in this country and working as a doctor in this country.
So my lived experience, I'm born and raised in Montreal. So that's where I'm originally from, living in Toronto now. As a child, I experienced racism, in the schoolyard, being called the N-word and things like that. But what I think was most painful is where teachers made assumptions about my intelligence at a very young age. And I saw it happen, time and time again to my classmates. So that's what I grew up seeing. And then becoming a physician and then looking at the data from 1996 to 2006 in Montreal, a Black person with a graduate degree had pretty much the same unemployment rate as a non-Black high school dropout. I lived that. I saw the people who went and got an education, did everything that they needed to do to advance and live that Canadian dream, and be denied opportunities. And I saw the impact that it had on my peers, on young people, seeing, our parents are telling us to go to school, but they're not getting the opportunities. And so, now when I look at the research and the data, and I see how across so many factors that affect health, whether it's income or it's education or it's our labor force, that people of African descent are denied opportunities, really just based on the color of our skin, even despite education. What is really painful is that the United Nations flagged that in Canada, institutionalized anti-Black racism is an issue here. They flagged that in 2017. So it's not just my opinion. It has actually been demonstrated through research, through reports, and even with the United Nations expressing their grave concern for people of African descent here in Canada.
So when you hear people say that there is no systemic racism in Canada, what do you think when you hear that?
Well, I think it's akin to where you might have people who are of a dominant group. So let's say men saying they don't think there's any sexism. When you're part of the group that is discriminated against, you are most likely to know where there is discrimination. I think in Canada, we have that denial. We aspire to that dream of, a multicultural society where everybody has equal opportunity. And I think it would be beautiful if we get there. I think we all aspire to that, but we have to face the fact that we are not there so we can take the right steps to get there.
You're president of the Black Physicians of Ontario. You also train public health officials. What's the biggest misperception among the public and public officials about the connection between background, racial background, ethnic background, and health outcomes?
I think there are a few, but I think one of the biggest ones that exist in medicine is assuming that race and genetics are tied together, so that where you do see differences between race, so let's say rates of hypertension, one would presume that it's due to genetic differences. But in fact, we know that there's no genetic or biological differences between the races. Race is a social construct that is used to create social barriers and stressors that then impact health. So the concept of race is only real insofar that we as a society categorize people that way and treat people based on that, but it is not biological.
Let's talk about race-based data. We don't collect it in Canada, though some cities are now starting to do that. You believe it is vital. Can you explain why?
For COVID-19, but even prior to COVID-19, to be able to take the appropriate measures to address health issues, you need a clear picture of what's going on at a population level. So that's kind of standard public health approach. So that's why we collect information on perhaps gender or where people live. Sometimes it's their postal code, just to get a sense of, risk factors, things that make people more vulnerable. The other reason that you want to collect the data is that if you do have an intervention, if you put resources towards prevention or addressing an issue, you want to know that it is actually improved and is working. On the other hand, for a lot of racialized and including Indigenous communities, there is a certain amount of mistrust with having, government leaders collect this information and interpret it in a way that can stigmatize communities. So we know that in Canada, lots of data has been collected on Indigenous communities and used to stigmatize them. We know that in the United States, lots of data has been used in describing African American communities and used to stigmatize and pathologize them to make it seem like something is wrong with that community instead of something's wrong with the society that put the community in that situation.
That's why there's been a hesitancy to collect it, race-based data.
Yes, on both ends. So I think for some people not knowing what to do or not wanting to deal with the consequences of understanding what the racial disparities are, and then also communities being concerned that it would be used against them. So on both ends. And so my position is aligned with the Canadian Public Health Association, in which they have recommended the culturally safe collection of race-based data, so that, again, it's not just about how do we fix these communities, but it's like, how do we address the factors in society that led to certain communities being predisposed to having higher rate of COVID-19 infection.
Before George Floyd was killed, this pandemic was infected with racism. Asian Canadians have been targeted, yelled at, spat at, and worse. People lashing out at them in the mistaken belief that somehow their Asian descent makes them responsible for the novel coronavirus. As Robin Gill reports, that is reopening old wounds.
Andy Sue's flower shop in Toronto's East End has been in his family for 48 years, passed on to him from his parents. He grew up in the multi-ethnic neighborhood and had never experienced racism.
I got white, I got lilac, I got pink.
Then he noticed his customers acting strangely when COVID-19 surfaced.
People started being a little bit more apprehensive about coming inside. After the whole Wuhan thing earlier in the year in the news, people started kind of questioning, was it safe to approach me anymore just because of my Asian background?
He was even asked if he had ever been to Wuhan.
I've never been to China myself.
The virus originated in Wuhan, China, and that fact has fueled attacks against Chinese Canadians like Trixie Ling. She was just going for a walk when she was confronted by a young white man who called her names and then spit on her.
I actually felt really angry. That was probably the strongest emotion I felt.
Angry that she'd been singled out in this humiliating way based on her racial background.
A lot of these racist incidents that has increasingly appeared, a lot of them is done by white folks. And so when it's that aggression and racism against people of color, there's this othering of you don't belong here.
The Vancouver Police Department says there's been a 600% increase in reports of hate crimes targeting the Asian community, whether they're of Chinese, Korean, or Japanese descent. A woman punched at a bus stop. An older man pushed out of a store. Chinatown sprayed with graffiti. British Columbia's anti-racism network doesn't think there's a rise in hate crimes. It's always been there. More people are just coming forward.
We're in a time right now when people are feeling more open about expressing their feelings. They're exposing their racist ideas.
The anti-Asian sentiment, also labeled the yellow peril, is entrenched in public health emergencies, going back to when the Chinese first started immigrating to Canada. Sandra Hyde is a Montreal professor whose research focuses on the correlation between pandemics and how different cultures get targeted during health scares.
In a pandemic where we have no cure, no vaccine, people are afraid and they want to place blame. And it's easy to place blame on somebody else who's different than you.
The Chinese were blamed for the 2003 SARS crisis because it first appeared in Guangdong. A Pittsburgh paper felt compelled to publish this controversial political cartoon. Then in 2020, a major Toronto newspaper took it a step further. And Canada's top doctor found herself in the crosshairs of racist rhetoric by a member of Parliament.
Does she work for Canada or for China?
I heard you might have found somebody new.
It doesn't help when celebrities get in on the action. Take this racist rant posted on rocker Bryan Adams' Instagram.
Because it comes from China. It's not racist at all, no, not at all. It comes from China.
Then there's the influence of the U.S. president. Donald Trump has been deliberately disparaging, calling it the Chinese virus.
It's always an open season. And I think recently it's been easier to be an open season because of the link between Asia and the epidemic, coming from China. People like Trump calling it the Chinese virus or the Wuhan virus, without understanding that, viruses know no borders.
Iran, too, was a hotspot for the new coronavirus. But the Iranian-Canadian community kept a lid on any attacks.
In terms of anti-Iranian sentiments and actions, there are cases that I'm aware of. But generally speaking, the community is not looking for conflict and they just want to let it slide. And we're trying to encourage them to come forward and speak out and feel comfortable doing that.
The outbreak of racism is so palpable in BC that the Lieutenant Governor launched an anti-racism campaign.
But sadly, our success has been marred by a troubling increase in race-based violence.
Different Together is aimed at quelling the hate, but it's a challenge with the overt anti-Chinese language coming from south of the border.
It's a topic that people need to be talking about, and we need to be normalizing the discussion about racism. What's happened in the United States, Donald Trump has normalized the ability to be racist. And in Canada, we need to do things differently. We need to normalize this discussion.
Anti-racism advocates believe it starts with education in elementary schools and should continue in the workplace.
You have to make it mandatory, just like universities are now making workshops on sexual misconduct mandatory. I think you don't set it up as if it's an option.
Trixie Ling knows she's now going to be a voice for change to end systemic racism.
It's not just a one-off individual thing. It's actually a collective structural problem that we have.
And Andy Sue has a message for anyone who wants to turn this pandemic into a cultural war.
This virus has no face. It could happen to anyone, and we shouldn't be afraid of each other.
To help guide us through some things to combat this, I'm joined by Professor Carol Liao. She teaches law at UBC with a focus on business law, ethics, and corporate governance. She's a second-generation Taiwanese Canadian. Professor Liao, thanks for joining us. You know, we like to believe in Canada that we're enlightened and tolerant and that racist acts are isolated. What is your sense of how pervasive anti-Asian racism is in Canada?
Well, there's a false sense of Canadian exceptionalism that forgets our very racist history. But we need to be honest about colonialism, the Chinese head tax and Exclusion Act, Japanese internment, ongoing anti-Black and anti-Indigenous violence and over-incarceration. We desperately want to see our past as disconnected from our present, like we're each some sort of self-determined island, and we don't like to acknowledge systemic racism. Right? It's much easier for people to be disgusted with hate crimes. Of course we're against that. And to compartmentalize acts of violence as isolated events until they finally come to a head like they are in the US. But it's much harder for us to admit our own racist tendencies, both conscious and unconscious. I've lost count of the number of people that have told me that they are colorblind or don't see race. There's a lot of defensiveness, and it's just not something I find people are generally open to talking about here, even though there is prevalent, casual, and systemic racism that exists.
So when it comes to this pandemic and COVID-19, how does it compare to anti-Asian racism that was linked to SARS 18 years ago? Is it worse now?
Well, I don't have to even look back to SARS to be reminded of anti-Asian sentiment. In the past few years, as Vancouver's housing prices have skyrocketed, there's been a lot of collateral racism. I'll be having coffee with a group and overhear someone saying they don't want to sell to an Asian person, and I'm right there. And I had a man shout a racial slur in my open car window as he drove by, and my 3 young children were behind me and heard it all. And that was pre-pandemic. So, this anti-Asian sentiment, none of it is surprising to me. It was all predictable, with some politicians practically inviting it. And, given the protracted period of COVID where the end seems so far away, and with the widespread suffering of so many people, and this convenience of misdirected blame on not just Asian, but any Asian-looking person, yes, it is worse.
There's overt racism, we know, and there's unconscious bias. You do training sessions to help companies overcome unconscious bias. Can you explain in simple terms what that is?
Oh, sure. A simple example is how we hear someone with an English accent and think they sound smart, yet research has shown any other accent and we judge more harshly. Empirical studies also show time and again how women and people of color have to work harder to establish competence in the workplace and prove it over and over again. So, the increased anti-Asian racism, it should remind Asian Canadians that we've often benefited from a system that's rooted in anti-Blackness, and how much the model minority position is only used to bolster the status quo until it's taken away. And, in Vancouver in particular, I hear people claim there can't be that much anti-Black racism here, given how many Black people they perceive are in Vancouver. And I'd like to ask, What is the right number for people to recognize racism? I've also heard so many people expressing surprise that there is anti-Asian racism given how many Asian people there are. It seems we're either too few to matter or too many to matter. So what's the right number before we're willing to recognize these things?
And what are the obligations, do you think, of business leaders and politicians not to enable racism, not to be complicit in it?
Well, representation matters. Take a look at the makeup of your leadership. The numbers are abysmal in the corporate sector. Less than 6% of board seats are comprised of people of color, and less than 1% are held by Indigenous peoples. Organizations should commit to anti-racist bias training, and it cannot be a one-off either. There must be education and deliberate ongoing interventions from both an individual and organizational level. They should amplify marginalized voices. They should have whistleblower protections and non-retribution policies, demonstrable inclusion practices. Each organization, of course, has their own issues, but there needs to be some introspection on the power dynamics within each institution.
Do you think this pandemic could be a teachable moment about racism, or could it make it more pervasive?
It's beholden on all of us to recognize that where we're situated in all of this. We can't have public ambivalence. My heart's been just broken too many times watching the uptick in overt racism caused by very live issues in the city. And we need to think about what we can do long-term to address the systemic racism within our communities. And hopefully now, with everything that's happening, we can spend less time discussing whether racism is real and exists within our institutions and focus more on what can be done about it. And change is the result of concerted, persistent, and ongoing efforts of many individuals that collectively move us towards change. And, time doesn't change things. Deliberate actions do. And we're living history right now. So it's time for us to step up and listen to those seeking change.
Still ahead, staying close to home.
I'm talking about a group of no more than 4 people.
Summer vacation plans shrink for Canadian families. Plus, going to waste, PPE pollution, and the Canadians stepping up to reverse the trend. And a looming debt crisis.
It's just not an affordable option for us right now.
Who the COVID-19 recession is hitting the hardest.
Long before this pandemic, alarm bells were ringing about the amount of household debt Canadians are carrying. Now, the financial stress for many is through the roof. Some aren't earning at all, many are earning less, and millions are getting emergency benefits from the government. What happens when all that ends? David Akin is exploring that for us.
A 1986 Honda Goldwing. A machine built for the open road.
My husband and I love to ride motorbikes in the summertime. That's just been something that we've clicked with right from the beginning when we first met.
But there will not be any long trips this summer.
No, that's just not an affordable option for us right now.
In fact, Crystal Chalmers is fighting now just to save her home.
We're really in a rock and a hard place right now.
With the pandemic, Crystal, a house cleaner, has not been able to work since March. Her husband's still working, but on much reduced hours. Neither are eligible for benefits like the CERB. And while their bank has given the Chalmers deferrals on the mortgage payments they make on their mobile home, the owner of the lot has not given them a break on the lot rent.
We're still paying over $700 a month just for our lot rent.
But now they're $2,500 in arrears to the landlord and facing the prospect of eviction.
Bill collectors are still calling, even though there's nothing we can do. Lot rent right now, even though we can defer our mortgages in mobile home communities, we can't defer our lot rent. And when you don't pay your rent, you can still lose your home.
To pay the bills, the Chalmers have had to add to their household debt. The credit card balance is higher. They borrowed $100 here or $100 there from friends and family.
As for paying bills, it's just beg or borrow.
So even if they get through all this, they are going to find themselves with more debt.
We don't have a plan. We're just trying to survive right now.
Millions of Canadians are fighting the same financial currents, forced to take on more debt to make it through the pandemic.
It starts with a health crisis, that triggers an economic crisis that quite likely is going to trigger an insolvency crisis. And how we handle each one of these things depends on how we handled the previous crisis.
And even before the pandemic hit, experts were sounding the alarm about rising debt levels. Fueled by low interest rates and a relatively strong economy, Canadians have been borrowing more and more for everything from new home appliances to new cars to home renovations. 20 years ago, Canadians had about $106 worth of debt for every $100 worth of disposable income. But over the last several years, that ratio of household debt to disposable income has soared to 176%. In other words, $176 of debt for every $100 of disposable income. And that was before the pandemic.
You're probably going to see it soar to something like 230%. And the reason is that the denominator, income, will have fallen because of the employment shock that we're having during the pandemic and the lockdown.
So $230 of debt for every $100 in disposable income.
I think we're probably going to end this crisis with even more indebted households.
The rate of household debt is super important to understanding how households can propel the economy, because they do. 57% of the economy is run on the fuel of household spending stuff. So as they take on more debt, they're going to be a little bit more skittish about how much they spend.
So far, thanks largely to federal income replacement programs like the CERB, personal bankruptcies and other credit problems have not yet ticked up. Yet.
I think what we're looking at potentially is sort of what's being termed the deferral cliff, meaning that government supports and payment deferrals end while the economy hasn't fully recovered, or in some cases for personal consumers, they haven't fully recovered.
CERB payments right now max out at 4 months, and mortgage deferrals only buy a few months of relief.
Government supports and payment deferrals for some of these debts are giving Canadians, to a certain degree, a false sense of security, which is actually allowing them to put off dealing with the debts, even though those debts may be just as bad, if not worse, when this situation ends.
Will things get worse for consumers? Well, consider this. Canada's big banks put aside an extra $11 billion in loan loss provisions in the last quarter alone. The banks clearly believe that some Canadians are not going to make it through. But the debt story in this, the COVID-19 recession, has a unique twist.
What is absolutely clear is that women have been hit harder than men in this recession, and that's the first time ever in history, because most recessions, usually men take it on the chin first.
That's women like Crystal Chalmers, working in the service industry, in her case cleaning homes. And it's the service industry that's been decimated in this so-called she-cession.
My children have really struggled. I myself have really struggled.
If Crystal is forced to move, her neighborhood will lose a leader. Crystal is president of her community league.
Because I'm a community leader, I have heard a lot of personal stories from people in our community, and the mental health of people has been what's really bothering everybody. Food and toothbrushes, soap.
And her community will lose a good neighbor, the curator of a giving cupboard for someone who might be having trouble making ends meet.
This is hand painted.
And they'll lose an artist and creator. Crystal's kids are old enough to be on their own, but for many women, going back to work cannot happen until there's a solution for looking after the kids.
Schools have closed, daycares have closed. They may be struggling with that financial impact and having to look for the care for their kids during that period.
And that means policymakers who want to ease a looming debt crisis have to deal with the responsibilities and stresses women face. A big one is childcare.
There is no recovery without a she-covery, but no she-covery without childcare, and we don't have a plan for either.
And while governments ponder that issue, individuals who need cash to get through the pandemic are urged to make plans and seek advice.
Do it now. Better to do it now when people aren't seeking help as much, rather than waiting during a period where maybe the demand spikes and then you're going to have trouble actually getting the help that you need.
Preet Banerjee is a personal finance expert, and he's with us from Toronto. Preet, so many Canadians were carrying so much household debt before this pandemic. Now the financial stress is through the roof. Do you think we're approaching a dangerous tipping point in Canada?
You know, I think we were dangerously close to a tipping point before COVID-19 really hit. If you take a look at consumer insolvency filings, they were starting to trend up towards the end of last year. The big banks had already started to assume people were going to not make their debt obligations. So they started to set aside more money for bad loans. And again, this was before COVID-19. And because of COVID-19, things have just gotten exponentially worse.
So let's try to divide up some of the problems and start with mortgages. More than 700,000 Canadians have applied for mortgage deferrals, but that's only buying time. They still owe the money, of course. If you're not earning, how do you deal with that?
Yeah, it's a tough situation to be in. And I think what people really need to focus in on is getting to that budget that they've been procrastinating about for a long time. It really comes down to what's coming in the door and what's going out the door at the end of the day. And if you've had these severe income interruptions, you really need to pay attention to what those expenses are and create a short-term emergency budget. Forecast what you would cut if you had to make those cuts in the future so that you reduce some of the uncertainty. It may not be good news, but getting a grip on your finances is more important now than it's ever been.
So cutting back on expenses, saving if you can. Preet, if people aren't working now and they don't qualify for emergency benefits from the federal government, can they do anything to insulate themselves from the financial crisis?
Well, that would be a very dire situation to be in if you have no income and you don't have any access to any of the income supports, which means you'd have to look at some extreme measures, which would include looking at all the things that you would unfortunately have to sell in your household, and also looking to see what kind of social assistance programs would be available for you as well. And I know that can be a tough idea to sort of stomach, but again, tough times call for tough measures.
The silver lining, I guess, if there is one, is that borrowing rates are so low, or is that really a silver lining?
Yeah, it's a good question. I think part of the problem is rates have been so low for so long that that's part of the reason that we got into these levels of indebtedness. What might be better is if interest rates are a little bit higher, because right now, if we think that things are going to get economically worse and there's going to be more fallout, what steps can, the Bank of Canada take to try and stimulate spending? We're already at low interest rates. We can't go much lower. So I don't know if it's a silver lining, and it's also been part of the reason why we're in this level of indebtedness in the first place.
Coming up,
it's going to be really difficult to replace.
The new reality of domestic tourism.
We're really focused on staying local this summer.
Where you can and cannot go for a family vacation.
There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.
Summer vacations this year are going to happen close to home for millions of people. Travel to the U.S. is still restricted. International travel may open up at some point, but with so much uncertainty, it's hard to make any plans. That means foreign tourists are going to be staying home too. Tourism is a big economic driver in Canada. From accommodation to transportation, 750,000 jobs depend directly on tourism. Most of that economic activity is generated domestically by Canadians traveling to places like parks, campgrounds, cottages, and attractions across the country. As Mike Drolet reports, this could be the year Canadians rediscover all the wonders of home.
For kids, it's the official sound of summer, that last bell of the school year before camps and trips and, well, at the very least, no classes for a few months.
First one's here.
But the summer of 2020 looks more like this. All our hopes and dreams dashed by an empty parking lot and a closed amusement park. We're all Griswolds now. Interprovincial travel is still banned in most of Atlantic Canada and the Maritimes, so only Newfoundlanders are enjoying the province's famous iceberg watching season. And it's not even easy for locals. The iceberg tracker isn't updating the location of the biggest bergs this year to avoid crowds forming. And across the Gulf and PEI, Anne of Green Gables has been silenced for the first time in 56 years. Atlantic Canada's most famous redhead may not have COVID-19, but fear of the virus spreading has shut down the Charlottetown Festival. So the bottom line is there's still a lot of uncertainty leading into the summer. Each province has its own framework for reopening, but interpreting that framework is up to the municipalities and local health officials. And it doesn't always make sense. So tourism board officials are recommending if you do travel, make it hyper-local.
So first of all, we're really focused on staying local this summer. If you're planning to go, further afield than, let's say, 50 kilometers, then call where you're wanting to go and make sure that they are open.
Welcome to the original Haunted Walk of Kingston.
For the past 20 years, Haunted Walks has introduced the curious to the darker and ghostly sides of Ottawa, Toronto, and Kingston. They offer walking tours outside where health officials say it's safer, which wasn't enough to sway Toronto and Ottawa to allow them to reopen. Only Kingston has given them the green light, but they can't offer their regular 15 to 20 person tours.
We can have social distancing between the tour guide and between a small group, but I'm talking about a group of no more than 4 people, so very small.
The impact on tourism is going to be massive. It's an $80 billion a year industry that contributes 2% to Canada's GDP. Take away $30 billion of that with no international visitors, and while the remaining $50 billion is domestic, that assumes Canadians will be traveling from province to province. Only Nova Scotia is open in Atlantic Canada right now, provided visitors quarantine for 14 days, the same rules that apply in Manitoba. Quebec, Ontario, Saskatchewan, Alberta, and BC are allowing visitors from other provinces, even though it's discouraged.
Tourism's big, obviously, is a big economic driver, but it also hurts the culture and fabric of our community in a way that I think is is going to be really difficult to replace.
So what are families to do? Day camps have been allowed to open in most of the country, albeit with tough restrictions, such as limits on the number of campers and a ban on transportation, which Howie Grosinger says applies to 80% of the kids at Camp Robin Hood in Markham, Ontario. As a result, Grosinger and his wife made the painful decision not to reopen until next summer.
The outdoor experience, the pool, the swimming, the instruction, and quite frankly, Mike, like social distancing and the camp experience are just not compatible.
No.
We have 4-year-olds to 6-year-olds, a good population of those. 75% of my day camp population are under the age of 8.
It sounds bleak, but travel agent Lorraine Simpson says there is some hope for adventure this summer.
There are deals to be had, especially if you want to go to Europe. I found some flights under $500 to go to Italy and also Portugal and even Greece. There's some amazing prices out there.
The hitch is that those traveling abroad have to quarantine for 14 days upon returning, but that could change, so you're rolling the dice. Flying within Canada is an option too, and while there are incentives, the deals aren't as good. Still, Simpson says people are itching to get out of their homes.
Who would go with me on a very early test pilot style trip, not knowing anything? And I just was inundated with people saying, yeah, I'm in. No questions asked. Yeah, I'm in. So people are ready to travel.
Perhaps the most intriguing summer idea involves camping. But since most campgrounds won't have bathroom and showers open, tents aren't an option. So that opens the door and the highways to RVs. 90% of Canada Dream's business in a normal year comes from Europe. But as we've come to know, 2020 is anything but normal. Domestic sales are certainly up, but nowhere near high enough to make up for the international loss.
And there's a lot of noise being made about RVs. A lot of people are saying that RVs are sold out. The campsites are sold out. It's utter nonsense. None of us are sold out.
So the RV door is one Canadians could walk through, if they're up for adventure, that is.
Next on The New Reality, the costs of protection.
It's another plague. Unfortunately, it's another plastic plague.
What we're doing to reduce waste while keeping ourselves safe. The term PPE, personal protective equipment, has been added to all of our vocabularies. It's not only essential for healthcare workers, it's now part of our everyday lives, or at least masks are. And many people are wearing disposable gloves, too. Problem is, they're disposable, and they're ending up in our rivers and oceans. The pandemic has created a new hazard to the environment. Redmond Shannon takes a look at
how we can do better.
The biggest plane in the world lands in Toronto, carrying 130 tons of medical supplies from China, including personal protective equipment. PPE is crucial for the safety of healthcare workers dealing with COVID-19. But now all of us are consumers too, particularly for simpler or non-medical face masks, but also for gloves. The problem is, not all of us are disposing of them properly. People across the world are seeing more and more discarded single-use PPE made from polymers that don't decompose. Yet another new source of plastic pollution, just as governments have begun tackling the issue. A group of French divers has started digging fistfuls out of the Mediterranean off the beautiful Côte d'Azur.
Forcément, tout ce qui est jeté dans la rue finit dans la mer sur la Côte d'Azur.
Diver Joko Pelletier says people must remember trash on the ground often gets washed into the sea. Similar scenes are visible around the globe. Dr. Hilary Nash is all too familiar with ocean plastic. Just before the pandemic, she travelled from England to Panama to take part in a sailing expedition to analyse plastic pollution in the Pacific Ocean.
This one particular day that stood out for all of us, we were about 2 days from land, so no one around us, no boats, no people, nothing. And for 4 hours, one afternoon that day, we had a constant stream of trash just floating past our boat. It's another plague. Unfortunately, it's another plastic plague that we're facing now.
Nash returned at the start of the pandemic, treating COVID-19 patients in an intensive care unit. She sees discarded single-use gloves and face masks on her short walk to work, a potential health hazard, and the types of PPE many experts say aren't really needed for the general public.
We will always need single-use plastic and disposable items in healthcare, specifically for infection control. We always have, even pre-COVID. And my message was always that so we can continue to do that in healthcare and protect people from infection, we need to be more mindful about the types of plastics and the types of pointless plastics that we're using in other aspects of our life.
Toronto hospitals are cutting back on waste too, repurposing their respirators by sterilising them. Necessity, the mother of invention, due to the strain on PPE supply.
When it comes to clean hands, the Public Health Agency of Canada says that washing offers more protection than wearing disposable gloves. But even if you need to wear gloves, you still need to wash your hands anyway.
Or you can make a face covering out of an old t-shirt.
Health agencies around the world offer tutorials on how to make reusable, washable face coverings.
So you got a much better fit on the side, much better fit underneath. And
Kim Troutman is an expert on PPE standards and certification.
The whole purpose of having people wear masks at this point now, if they're just, whether they be do-it-yourself masks or the ones that we can still purchase, are for the purpose of us not spreading the disease.
Troutman says homemade masks can be better for non-medics because you can make them to fit your face, and she recommends using more breathable natural fabrics like a high thread count bedsheet.
Why natural materials tend to be better is they have a rougher fiber, and that rougher fiber acts and can catch more contaminants or particles.
Troutman uses washable garden gloves when shopping, but insists you need to be very careful when using any gloves.
But again, if you come out of any usage with those gloves and touch any surface, you are now contaminating the surface.
Reusable masks could become a part of everyday life now, so this Montreal fashion house decided to cater to the market.
We basically recycled all the ends of rolls that we had of all the fabrics that we've had from previous collections.
Demand has been really insane, actually. We are trying to keep up with demand, which is amazing.
The high-end fashion items sell for $50, but 10% of that goes to a local women's shelter, acknowledging the hidden trauma of domestic violence in a pandemic lockdown.
You know, since we dress women and part of our mission is to empower them, you know, how can you feel empowered if you don't feel safe?
So we're proud to say that it's 100% made here. Our materials are responsible and they're easily washable and reusable.
A reminder that tackling the worldwide problems of pandemic and pollution can sometimes overlap with helping those closer to home, too.
We'll be right back on The New Reality.
And that is our program this week. Here are some stories we're working on for The New Reality. We've known about the novel coronavirus for 6 months now, and it's still outsmarting us. We have no treatment and no cure. Coming up, we look at the many things scientists still don't know about this virus. And the pandemic has reduced our collective carbon footprint. That's a good thing. But what does it mean in the long term for climate change? All those stories coming up. I'm Dawna Friesen. Thanks for watching.